Hello, my name is Kath Noakes and I'd like to welcome you to the Breathing City, the Future Urban Ventilation Network. This is a new network funded through the SPF Clean Air Programme, and it brings together academic partners, industry partners, Public Health England and various other government departments in order to try and understand how we can better design ventilation for the urban environment. The network is led by 16 investigators across 9 academic institutions and Public Health England, and together we will be shaping this network to drive forward new ideas in the future of ventilation in the urban environment. So the premise for this network is based on the fact that airflows ultimately determine our exposure to pollution and therefore the health effects that come from that. So it's all very well measuring pollution in environments, but unless we understand the airflows, we can't predict or determine what might happen or design to ensure that we mitigate these risks. There are a number of other drivers too for the fact that our ventilation networks currently are very much focused on the physical performance of the building, but we need to rethink these and say actually how much of these are based around health and how can we update them to be more health-based for our indoor and urban environments. And then to drive that, we need new innovation to enable our spaces to be healthier, rather than just relying on past designs and past options. But this is very complex. So we can't just look at indoor air quality alone. We have to also consider all the other factors that affect this around the energy, climate impacts, thermal comfort, noise, and all of these factors will interact together to determine the quality of the environment that we experience. It's also the fact that the flow in both indoors and outdoors and between the two is incredibly complex. So it isn't a simple thing to just consider how, when you design a building and design its ventilation or even retrofit a building, how the flows will work in that space. And we need better understanding of how to connect the models together to understand how to predict the airflows and therefore the exposures that people might experience. And we're also well aware that there's quite a lack of public and policy understanding of ventilation. It's often just assumed that buildings are ventilated, yet there's very little awareness of how this should be done and how people and their behaviour had an impact on this. And then, of course, over the past 12 months, we've got vast new challenges raised by the COVID pandemic, and this has raised awareness, the fact that indoor environments and pollutants that we might be exposed to also include infectious diseases. And as this past year has shown us, this can be an incredibly significant factor and has really raised awareness of the poor ventilation in many buildings. So our project will run over 3 years. We will bring together people across 3 connected themes in order to try and develop a new framework which will integrate health with the design of buildings and the urban environment. We will look at how we can couple the flows indoors and outdoors together. We will look at the design for health-centred ventilation and what the metrics should be there. And we will look at what this all means for regulation, practice and guidance and how these things might need to change. And we will consider across a multitude of different factors, constraints, and across the different scales from the city scale through to the person in the indoor environment. And so across the network over the next 3 years, we want to scope this new Breathing City framework to think, how do we integrate health evidenced ventilation design into our buildings and think about those airflows differently. We will be defining and initiating new research to be able to model these flows properly, think about pollutant transports and exposure risks, as well as consider the behavioural and community aspects to this. And through this, we want to build partnerships with industry, with academia, with government departments and with the public in order to drive technology solutions and enable user engagement, and ultimately to identify policy requirements that would enable this new approach to be taken into practice. So over the next 3 years, we've already held our launch event on the 18th of January. We'll be running a series of workshop and engagement programs to look at bringing people together, sharing issues and defining this plan. And then we'll be looking at how we can use pilot research activities to test new approaches in order to stimulate new ideas in how we can create a more holistic approach to urban ventilation. So I very much hope that you will join us. We are on Twitter and we have a website. If you wish to get in touch with us, please email us. Thank you very much.